Welcome to Healthy Outlook, the medical news magazine of the EMH Regional Healthcare System, where in each program we'll bring you up-to-date health information featuring real people and their stories of success. In this half hour, see how a technological breakthrough has drastically minimized recovery time and discomfort in aortic aneurysm patients. Also, see how heart disease gave these two men a healthier outlook on life. These stories, plus whip up a quick dish with our Healthy Outlook food segment. And now there's no more excuses. We'll show you some anywhere exercises to get you in shape. All this on Healthy Outlook. Most of us have heard about a person dying suddenly from an aneurysm, either from a personal experience or on the news because it was a professional athlete or some other well-known personality. The site of the aneurysm is often the aorta, the large artery that exits the heart and carries oxygenated blood to smaller arteries throughout the body. The thoracic aorta within the chest or the abdominal aorta within the abdomen may be involved. In this program, we will be talking about a new, less invasive treatment for abdominal aortic aneurysms, which decreases recovery time and discomfort to the patient. An aortic aneurysm may be symptomatic of past family history or the result of a medical illness. Most aortic aneurysms produce no symptoms. They are often discovered unexpectedly during a routine physical examination or during X-rays for an unrelated illness. When symptoms do develop, they may include pain in the abdomen or back, an unexplained feeling of fullness after eating only a small meal, nausea and vomiting.
I was fine 1 minute, and then 5 minutes later I was as sick as I could be. I started vomiting, and I vomited about 3 o'clock at night, next morning. So we took me to the emergency room.
In about 20% of cases, an undiscovered abdominal aneurysm ruptures without warning, and the patient suddenly collapses and usually dies due to massive bleeding inside the abdomen. Once an aortic aneurysm develops, it is a lifelong condition. Most abdominal aortic aneurysms grow larger with time, expanding at an average rate of 1/3 to 1/2 centimeter each year. You may be able to reduce your risk of an aortic aneurysm by controlling your risk factors.
If patients have a positive family history of abdominal aneurysms, they should certainly let their family physician know about this. They mainly occur after the age of 55, more common in people who smoke and have high blood pressure. So certainly if any of those additional risk factors are present, definitely need to undergo some sort of screening process, and the best screening process would be a simple ultrasound of the abdominal aorta.
The standard treatment of an abdominal aortic aneurysm depends on its size. This is because larger aneurysms above 7 centimeters in diameter have a 19% chance of rupturing annually, and in most of the cases cause death. Smaller aneurysms, around 5 centimeters, have less than a 7% risk of rupturing annually. Surgery is almost always necessary for any patient who has an aneurysm greater than 6.5 centimeters in diameter, or who is having aneurysm-related symptoms. In general, it's recommended that aneurysms be fixed when they reach between 4 and 5 centimeters in diameter.
Usually, the gold standard is anything above 5 centimeters, it has to be fixed. When the diameter of the aneurysm exceeds 5 centimeters, the chance of rupture is very high. Therefore, this has to be fixed. Also, if the person is small and the size of the aneurysm double the size of the aorta, it can be also at a high risk of bursting. For example, if the aorta size is 2 centimeters and the size of the aneurysm 4.5, it has to be fixed. The other important also reason to fix it if the aneurysm is stretching over the time. So we check it today, it's a 4 centimeter, and 6 months becomes 4.5, meaning it's getting bigger and it's going to rupture sometime soon, so surgical intervention will be important.
Up till now, the aneurysm has been repaired with a graft placed during major abdominal surgery. But now there's a new, less invasive option to the surgery called the ANEURYSM procedure. This new breakthrough involves placing a Dacron-covered stent carefully inside the aorta. The stent acts as a scaffold to keep the aorta open. The Dacron graft acts as the new aorta, taking the pressure off the damaged aortic wall.
That's usually done by needle puncture or small incisions in the groin, about 1 inch each, by both groins. And this stent graft is inserted, and that takes about usually 2 to 3 hours to do, and people go home next day.
The procedure is more invasive and complicated than a standard coronary angioplasty, but can still be performed in the catheterization lab rather than an operating room. George Duvala is one of the first recipients of this new procedure.
You know, when Dr. O'Shaughnessy was telling me this was going to be his first one of this type of stent, it didn't bother me. I thought, you know, hey, this is better. It's got to be better than the ones they've been doing. So I was, you know, felt fortunate that they were able to do this.
This is a sterile procedure like any other surgery, requiring the doctors and medical personnel to scrub and wear the proper surgical attire. A cardiac surgeon is in the room at all times and does the initial incisions to provide access through the femoral arteries in the legs.
A male patient was seen previously because of large abdominal aortic aneurysm, and since we are starting to perform stenting of the abdominal aneurysm, the patient underwent special CAT scan, which showed that he's a good candidate for insertion of the stent. The first step here we do to make a small transverse incision, almost 1 finger breadth below the inguinal ligament, to expose the common femoral artery. The incision go deep to the femoral fascia. And then we dissect the lymphatics longitudinally to prevent swelling postoperatively. There's a lot of advantages to do this procedure if it is applicable. As you see here, there is a 2 small incision in the groin versus a very long incision here if we are going to go with a surgical repair. This patient is awake under epidural anesthesia. Procedure will take less time and less blood loss, I hope. And hopefully, if everything goes fine without problems, this patient should go home either tomorrow or day after. Compared to the surgical repair, which require hospitalization for at least 5 to 6 days.
The first step is just to take a diagnostic angiogram for landmarks on where we're going to be and what we're going to do. I need the screens back now so I can see. Okay. The quantification.
1 inch above it.
Okay. Ready? Inject. Yeah, we got the bifurcation, we got it all. Let's not move anything. Okay, let's mark those. Replay it, please. Yeah, you can play it back and mark it. Just freeze it up there with the renals first so she can mark where the renals. That's the low one right there. The other one's above it, so that's okay. And the bifurcation is, play it down at the end now. Just play it through so the contrast. The bifurcation is right down there, yeah, just at the end of the screen. Right there, that's it.
I'm going to count while I'm here.
Yeah, sure.
So I've got
That's about it.
Freeze it up for us, please.
1,
Freeze
2,
it.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 and a half.
Okay, so we could
That's
probably,
pretty much what they measure.
so we could probably go with the 16 device, don't you think? Or we're gonna go with the 17. 17 is just safer, I guess, huh? 7
We've got
safe.
long enough iliacs.
Yeah, we got a good landing zone. Let's go with the 17.
Once the patient is prepared and ready, the doctors maneuver wires through the arteries into the aorta. These wires act as a guide to slide the stent into place.
Try that. Try that. You got it. Okay. No, wait. No.
I think we
You
got
gotta
it.
advance the catheter. You got the catheter?
Yeah.
I think you got it.
Once the stent is in position, the wire is drawn back, exposing the stent graft system. The whole graft is then pulled down into place. The first balloon is inflated to expand the stent.
Okay, there's the, see right there where that's a balloon marker there, and we're going to, we've got the hooks exposed in the top part of the graft, and now we're going to seal the hooks into the wall of the
See the balloon
artery.
inflating now?
Okay.
The black part is the balloon.
You do this to profile.
Yeah.
Yeah, one.
Yeah, a little bit
More
more.
than two.
No more than 2. For a minute.
Even at one.
No, we're not quite there yet, I don't think. We gotta go a little higher.
Another balloon is then inserted to expand the left femoral portion, and the original balloon is drawn down and partially inflated to complete the procedure. A complex yet very effective procedure that only a handful of physicians are able to perform. But EMH Regional Medical Center has a long, rich history in cardiology.
Initially, when I started doing cases, we did about 52 cases a year in 1974. And that was fairly decent number at the time. Now we are doing 5,600 in 2000, year 2000.
The doctors at EMH have achieved national recognition in cardiology. There are many benefits to the ANEURYSM procedure.
The aneurysm occurs usually in older people, and as we see more and more people getting older and older, and we see more older people in our practices, that all these non-invasive or semi-invasive procedures make a lot of sense because they carry a smaller risk compared to a major operation.
Patients usually go home the next day, needing only over-the-counter pain relievers.
No pain whatsoever. And I had to stay overnight in the hospital in intensive care one night, and then a regular room one night. I was sent home the next day with no medication and was able to go about and do my chores in my house in a few weeks.
Well, I got out of surgery at noon Thursday, and I left the hospital at 8 o'clock Friday night. And I was sent home without any pain medication or anything. So this surgery I had, I feel it didn't put any restraints on anything I wanted to do, say after a 2-week period, you know.
Only certain patients are candidates for the ANEURYSM procedure.
Approximately 50% of patients who have abdominal aneurysms originating below the kidney arteries will be candidates for the endovascular procedure.
But by no means is the standard surgical procedure a thing of the past. It is a time-tested and proven way to fix aortic aneurysms and very effective in saving people's lives. But for those patients who are candidates, the benefits are obvious.
I just felt fortunate that Dr. O'Shaughnessy was able to use the procedure on me that he intended to do. So, and that there were no complications in surgery, because he told me that there could be, you know, and everything went fine. So I got to be thankful for that.
It was just amazing. I was just thrilled that I'd be able to be part of that, you know.
And now for our healthy outlook on food, sponsored by the EMH Center for Senior Health and Wellness.
Hi, I'm Karen Kennedy, and today we're going to be making oat and raisin bran muffins. They're high fiber. There's 2 grams of fiber per muffin, low fat, low carbohydrate, so they're just all around healthy for you. So the first thing we're going to do is we're going to take, I have all my ingredients already measured out, so we're going to take all the dry ingredients. I have 1 1/4 cups of oat bran and 1 1/4 cups of raisin bran cereal, and 2 cups of whole wheat flour, and 1/2 cup of brown sugar, and 1 teaspoon of cinnamon, and 1 cup of raisins. We already put raisin bran in, but the extra raisins give it an extra source of vitamins and fiber and nutrients, so it's 1 cup in addition to the raisin bran. The recipe calls for 2 to 3 teaspoons of baking powder, so I'm going to add 3. because all that fiber might make it a little heavier with the whole wheat flour, so you want to make them rise a little more. Those are all the dry ingredients. The liquid ingredients, we have, the recipe calls for 2 egg beaters, or the equivalent of 1/2 cup of egg whites. And what I've done, instead of using egg beaters, what I always do is take the egg yolk and separate it from the egg white, and I've measured out 1/2 cup. So this is just as good as purchasing egg beaters, and it's a lot cheaper. And then we take 2 cups of skim milk. That's non-fat milk. If you want to, you can even substitute 2 cups of soy milk or 1 cup of regular milk and 1 cup of soy milk to increase the soy protein, but we're not going to do that with this recipe today. We'll just use regular skim milk. Okay, and here we have 1/2 cup of molasses. It's the dark molasses. Okay, you stir the liquid ingredients together. And you stir the dry ingredients. So these muffins would make a nice addition to breakfast, make a nice addition to lunch with a salad, or it would make a great high fiber, low fat snack. Okay, then we're going to pour the liquid ingredients into the dry ingredients and stir. So the goal for fiber is 30 grams per day, so it's pretty tough to get that, and you get that through fresh vegetables and fresh fruits and whole grains. So this has the whole grain that's in the oat bran, the whole grain that's in the whole wheat flour, and it has the fiber that's in the raisins. So that's why the fiber content is pretty high in this recipe. Okay, once you've got the dry ingredients and the liquid ingredients combined thoroughly, you put them in baking cups. I filled each baking cup about 3/4 of the way full, and once that's done, you can pop them in the oven at a temperature of 425 degrees for 15 minutes. Okay, our muffins are ready. Take them out of the oven. And remember, they're a great source of fiber. Each muffin has 2 grams of fiber per muffin. If you eat 2 muffins, they have 4 grams, and you're on your way to your goal of 30 grams.
To look at these 2 pranksters, you'd never guess that they are cardiac patients. Ron Graneman, a local barbershop owner, has had bypass surgery and several stents.
After the surgery, I had a lot of depression, why me kind of thing.
And David Sisson lived most of his life with a defective heart valve, until having it replaced in open heart surgery less than 2 years ago.
I couldn't play football because of it. Kept me out of the service. I got to be 24 years old, and we went to my cardiologist, who was Dr. Beck here in the Cleveland Clinic. And my wife and I went in, and we said to him, I'm going to get married. He looked at my wife, and he said to my wife, I wouldn't marry him if I were you. He's not going to make it till he's 30 years old.
So why are they smiling and feeling so great? They say monitored exercise at the EMH Center for Health and Fitness literally turned their life around.
I have a lot of enthusiasm, and I have a lot of energy again. I had lost all that, and I really say it's the exercise program that did it.
David had never committed to an exercise program until after his surgery, and admittedly wasn't excited about the idea at first.
First of all, I hated all the exercise programs I had been on before. I'd been on it for 2-3 months, and then I'd quit, and I'd do something at home. I bought a treadmill here, I bought a bike here, but I just didn't have the incentive to keep doing it.
And even though Ron had a history of exercise, he had similar thoughts on joining a cardiac rehab program.
Well, I got out of the hospital after my surgery, and about 6 weeks, 7 weeks later, then they suggested that I look at this rehab, and I went over and looked at it, thought it was kind of a joke.
But Ron and David had a change of heart after realizing the many positive benefits of a monitored exercise program.
When I got there, the fact that we had the nurses there that were monitoring me, and the fact that it was a scheduled program that I was on a daily basis, and it wasn't a 3 or 4 hour deal. You could be in and out of there an hour, hour and a half. Mentally and psychologically, I just started feeling better as I went along.
Started the program just kind of really on a fluke, and I've been going for 3 years, and I really am a firm believer in the whole process.
Another major benefit of exercise is the building of collateral arteries in the heart. Collateral arteries are smaller arteries that help to provide additional blood flow to the heart. This collateral blood flow has been known to save patients' lives, taking on the blood flow when a main artery has been completely blocked. Regular exercise can help to build these life-giving arteries in your heart.
That people who go in the cardiac rehab program get back to their normal lifestyle, normal activities much quicker after angioplasty, after bypass surgery, after a heart attack than if they are not involved in these programs. So I think it's a very useful program.
Ron and David aren't necessarily interested in the details. They just know that they enjoy the exercise and look forward to the camaraderie.
I've met quite a few people, wonderful people that you can work with, people that you have fun talking to in the morning, because we're all in the same situation. We're all getting healthier. We're all watching ourselves. We've all either had operations or some type of a heart procedure.
The rehab will help you get past is the feeling bad for yourself. There are other people that are having these problems. It just helps to go to rehab and share this stuff with other people. The social thing, you make a lot of friends. I've made a lot of friends over there.
If you want to feel better and possibly prevent getting heart disease in the first place, check with your doctor and see if an exercise program is right for you. If you have had a heart attack, heart surgery, or heart problems in general, ask your cardiologist about a monitored cardiac rehab program. The benefits are numerous.
With the nurses that we have, you get to know them very, very well, and it's like you're working with your family, which really makes it nice.
This is the new therapy. This is a new therapy. We kill you or cure you.
A healthy diet is also important to heart disease prevention. It's important to eat a well-balanced diet that not only includes the recommended daily servings, but also incorporates foods that researchers have proven to be beneficial in reducing your risk factors. One of the most recent findings is the benefit of soy for women. Yet one of the oldest findings researchers still stand by is breakfast, the most important meal of the day. Once you decide you are ready to improve your eating and exercise habits, the real challenge comes with actually doing it. And it's not just doing it for a week or a month, but as a lifestyle change. America is waking up to a heart-healthy way of life. And you can, too.
Hey, nice regular rhythm there.
Nice regular rhythm. All right. All right.
Looking good, looking good.
Now to keep up with the theme of health, a healthy outlook on exercise, sponsored by the EMH Center for Health and Fitness. Remember to always consult your physician before starting any exercise program.
Hi, my name is Ann Muth. I'm the Program Director at the EMH Center for Health and Fitness. And today I'm going to show you a couple exercises that you can do at home, at work, at your leisure to help you, number one, strengthen your body, and then also to stretch your muscles. The first exercise I'd like to show you is an upper body strengthening exercise called a wall push-up. Most of us are not able to perform a wall or a push-up on the floor. So this is an exercise that is modified to help you still strengthen those muscles in the chest and in the back of the arms. What you would do is stand about arm's length away, a little bit farther than arm's length away from a wall, arms extended from your right out in front of you at the chest level. Then you're going to lean your body just as straight as a board in toward the wall, and then lean that board or your body to the wall and push away from the wall. And you just continue and try as many repetitions as you feel comfortable doing. What's very important is you want to make sure that that board remains straight, keeping your tummy tight and bringing your hips with you. Once you've finished or completed that exercise to strengthen those muscles, the next thing that you want to do is to make sure that you let those muscles relax or to stretch those muscles. And this is something that you can do one arm at a time. It emphasizes the front of the shoulder and the chest muscle that you just exercised. Again, standing close to the wall, you want to place a flat palm with your fingers pointing backwards toward the wall. Arm is straight and at chest height. Take one step forward and then gently push that shoulder forward. And you should feel a stretch coming all the way across the front of the shoulder, in through the bicep, and down through the chest. Hold that maybe 6 to 10 seconds. Gently release it by shifting your weight to that back leg, and then once again, gently move forward, shifting your weight to your front leg, and hold, and release. And that's it for this program. See you next time.
Now, let's keep informed with our healthy outlook on the community. To enroll in any of our screenings, or if you would like more information on anything seen on this program, call the EMH Regional Healthcare System at 1-888-GET-EXAM. Thanks for watching, and be sure to tune in next time to Healthy Outlook, the medical news magazine of the EMH Regional Healthcare System.